Question about intra-articular therapy. The question is specifically about Arthromed, that let's say it's injected and the benefit is seen for about 6 months. Do you go back and repeat that intra-articular injection with the same medication, or is there a point where you would switch to something else?
So that is a really important question, and I've probably used more of the Arthromed, Cinnamid than any veterinarian in the United States, or maybe in a number of countries. So there's two answers to that question that I'm going to give. Is sometimes we inject Arthromed, and it appears that we don't get a response, and if we repeat that injection, I give them up to 3 months. If we repeat that injection at 3 months, we seem to get a very good response. So I don't know whether it means like they needed a larger volume, something went wrong. Like I can't answer that. So that's one permutation. But to answer the direct question is if it lasted for 6 months or so, I have no qualms about reinjecting it and getting a similar, if not better, effect the second time around.
Any additional thoughts, Dr. Barton?
A few. I think it's important to recognize the stage of arthritis that you're addressing. And so dogs and horses are slightly different. And both of these products we're talking about today are tested in both species. So if we're in an inflammatory state, if we have a lot of synovitis in a joint, you might choose one product over the other. You might choose Cinnamid. If the joint appears to have big cartilage loss, and your true cause of pain might be more mechanical, you might be thinking about using the spring product. And that's where I think it's tempting to use a combination because we want to address all of the problems. I think it's important to try to evaluate what your patient is doing and showing you. So if there's a patient that is responding more to an anti-inflammatory or maybe not to an anti-inflammatory, that might help sway my decision for what I choose.
And just to add into that, I probably inject more elbows than any other joint, since they're the most difficult joint in a dog body to get comfortable. And just like Dr. Bartley was talking about, most of these dogs with advanced elbow disease have medial compartment disease and don't have much, if any, cartilage component there. And so that is really where this combination of spring as a cushioning agent, hyaluronic acid as a lubricant, and Cinnamid as an anti-inflammatory really becomes critically important when we really know that they have minimal cartilage to work with.
Mm-hmm. And for what it's worth, I've seen one or two patients that had a combination, but maybe to your point, Dr. Yainer, they didn't have enough volume, and maybe that they needed more cushion and less lubrication in one scenario or another. So I think the answer is you may have to create, this is an art form. Being a veterinarian is an art form, and every patient is an individual, and on different days and over time will need different treatments. And so we should never assume that because it didn't work or we think it didn't work, that it's not the right path.